Are you or is someone you love living with a serious illness that's impacting quality of life? If the answer is yes, chances are that you could be benefiting from the support of a palliative care team, even if you're not quite sure what palliative care is. And the trouble is, a lot of doctors still misunderstand what palliative care is too. So if it comes up in conversation, your doc will say something like, "Oh, whoa, you think it's time for palliative care yet?" Or, "Oh no, we're not going to stop fighting yet." And if you hear your doctor say stuff like this about palliative care, that's a giant red flag that they don't know what palliative care is. And that might mean you're missing out on vital support you could be getting for your quality of life right now. So what I'm going to do in this video is clear the air. I'm going to tell you what palliative care actually truly is, what a palliative care team could be doing to support you right now, and also walk you through how to find palliative care support and how to advocate for a referral from your doctor. This is going to have a lot of information, very high yield with some nuts and bolts stuff here, so stick around. Let's go. So let's just dive straight into the actual proper definition of palliative care. Palliative care is specialized, team-based medical care for people living with a serious illness. The focus is on providing relief from the symptoms and stress of a serious illness with the goal of improving quality of life for both the patient and their family. A palliative care team may include doctors, nurses, social workers, and other disciplines who all work together with the rest of your medical team to provide an extra layer of support. Palliative care is needs-based, meaning patients can get the support of a palliative care team no matter how old they are and no matter what stage of the illness they're at. In other words, palliative care can be provided alongside curative treatment. Now that last bit is very important. Let's rewind. Palliative care can be provided alongside curative treatment. And this is where so many doctors still get it wrong. So many doctors still think of palliative care and curative treatment in some sort of either or relationship. So they wait until they've exhausted every possible treatment under the sun for you to even bring up palliative care, when you could have been getting their support all along. So what would that support look like exactly? Well, because palliative care is individualized and focuses on improving your quality of life, that's going to mean different things for different people. But in general, a palliative care team is going to sit down and listen to you, get to know you, and understand what's most important to you. They're going to learn what living means to you and what not living means to you, so they can focus in on what's going to improve your quality of life the most. And for some people, that's going to mean focusing in on symptom management, like improving their pain control. And for other people, that's going to focus in on planning for the future, getting stuff in place so they can just rest a little bit easier knowing that plans are made. And for a lot of people, it's just sort of a mixture of all of it. And really, alongside that goal of improving quality of life, the goal here is to help you feel in control of your healthcare and healthcare-related decisions. So if you're thinking, hey, palliative care sounds pretty good, I think I'd like to see what they can do for me. Awesome. I'm so glad to hear that. So let's talk about where you can find palliative care support. Palliative care is provided in three main areas: hospitals, homes, and clinics. Now, if you're in the hospital right now, well, you just reach out to someone on your medical team and ask if there's a palliative care team on staff there. And if there is, just ask for a referral. If you're looking for outpatient support, then where I would go first is this great database, this great website really called getpalliativecare.org that has a great database, the Palliative Care Provider Directory, where you type in your zip code and the location of palliative care you're looking for, meaning hospital, home, or clinic, and they'll tell you what's in your area. The caveat I'll give is that I've tested this with my zip code, and I've noticed it's not entirely comprehensive based on my knowledge of what's in my area. So where I would go if you don't find any good leads here is hop over to your insurance carrier's website and do the whole provider search there too. Type in your zip code and palliative care and see what pops up. And hopefully between the two, you'll get a decent lead here. Now, ultimately, once you find a place for outpatient palliative care support, there's a good chance you're going to need a referral from your primary doctor or your oncologist or whoever's coordinating your care right now. And hopefully this will be a non-issue, but some patients I've talked to do get pushback in this regard, and they'll hear stuff like I mentioned at the beginning of the video, like, "Oh, I don't think you're ready for palliative care yet." And again, if so, this is because they misunderstand what palliative care is, and you may need to educate them yourself. So what I would do is take a step back and explain your intentions to say, "Hey doc, all I'm looking for is an extra layer of support for my quality of life. I'm not making any decisions about stopping treatment or anything like that, so don't worry. And hopefully when they hear that, they'll back off and just get you that referral, and it will go back to being a non-issue. Either way, don't let a doctor's misunderstanding about palliative care hold you back from getting all the great support that they can provide for you. I hope all this information helps you advocate for the support that you and your loved ones deserve.